Hello everyone, and welcome to Who Created It and How. Today we're diving into a topic that's both fascinating and a little bit frightening. Surgery. Who was the very first person brave enough to cut into another human being to heal them? The answer, as you might guess, isn't a single person, but a story that stretches back thousands of years, long before shiny operating rooms and sterilized scalpels. Let's travel back in time, way back to the Stone Age. Imagine living around 7,000 years ago. No cities, no written language, just small communities trying to survive. Now picture this. Archaeologists in France discover a skull from this era with a perfectly circular hole cut into it. But the most incredible part? The bone around the hole shows signs of healing. This means the person not only survived the procedure, but lived for some time afterward. This wasn't an accident, it was an ancient surgical procedure called trepanation. Trepanation is one of the oldest surgeries known to humankind, and evidence for it has been found all over the world, from Europe to South America. So why were our ancestors drilling holes in each other's heads? We don't know for sure, but theories range from treating head injuries and releasing pressure from brain swelling to more spiritual reasons, like letting out evil spirits believed to cause seizures or mental illness. Whatever the reason, the success rate was surprisingly high. It shows that even in prehistoric times, people had a deep understanding of anatomy and healing, likely passed down through generations. They would have used sharp flint or obsidian tools and probably had plant-based antiseptics and painkillers we're still rediscovering today. So the first surgeons weren't in a hospital. They were likely shamans or respected elders in a Stone Age tribe. Now, let's fast forward a few thousand years to ancient Egypt, around 1600 BC. Here, we find the Edwin Smith Papyrus, one of the oldest surviving medical texts in history. It's essentially an ancient trauma surgery textbook. Unlike other medical texts of the time that blamed illnesses on gods or curses, this papyrus is incredibly practical and scientific. It describes 48 cases of injuries, fractures, wounds, and dislocations, complete with diagnoses, treatments, and prognoses. It details how to set broken bones, stitch up wounds using a needle and thread, and even how to handle spinal injuries. The papyrus also mentions using honey as an antiseptic, something we now know is effective because of its antibacterial properties. While we don't know the name of the author, this Egyptian physician was clearly a master of their craft, a true pioneer who relied on observation and logic. Next we journey to ancient India, around 600 BC, to meet a man often called the father of surgery, Sushruta. His work, the Sushruta Samhita, is a monumental text that describes over 1 to 100 diseases, hundreds of medicinal plants, and most impressively, details over 300 different surgical procedures. Sushruta was a genius. He described cataract surgery, how to manage fractures, and even early forms of plastic surgery. His most famous contribution is the nasal reconstruction, or rhinoplasty. In ancient India, cutting off someone's nose was a common punishment. Sushruta developed a brilliant technique to rebuild the nose using a flap of skin from the patient's forehead. This method, known as the forehead flap rhinoplasty, is so effective that a modified version of it is still used by plastic surgeons today. He also designed over 120 different surgical instruments, from scalpels and forceps to needles, many of which are recognizable predecessors of modern tools. Sushruta emphasized cleanliness, precision, and the importance of a surgeon's skill and steady hand. Meanwhile, over in the Greco-Roman world, surgery was also advancing, thanks to figures like Hippocrates and later Galen. Hippocrates, the father of medicine, established a code of ethics and promoted the idea that diseases had natural causes, not supernatural ones. While he favored less invasive treatments, he did write about setting fractures and treating wounds. Galen, a Roman physician who served as a doctor to gladiators, gained immense hands-on experience with trauma. He learned a great deal about anatomy by treating the gruesome injuries of the fighters and by dissecting animals, since human dissection was forbidden. Galen's writings on anatomy and surgery became the undisputed authority in Europe for over 1,000 years. However, because he could only dissect animals like pigs and monkeys, some of his anatomical conclusions were incorrect, which actually held back progress for centuries. After the fall of the Roman Empire, Europe entered the Dark Ages. Much of the medical knowledge from Greece and Rome was lost or suppressed. Surgery became a crude, often brutal craft, usually performed not by physicians but by barbers. Yes, you heard that right. Barber surgeons. The red and white striped pole we still see outside barbershops today originally symbolized blood and bandages. These individuals would pull teeth, let blood, and perform amputations right alongside giving haircuts and shaves. It was a messy, dangerous, and incredibly painful business with a very low chance of survival. Anesthesia didn't exist, and the concept of germs was completely unknown. Infection was almost guaranteed. But while Europe was in a scientific slump, the Islamic Golden Age was flourishing. From the 8th to the 15th century, scholars in the Middle East preserved and expanded upon the works of the Greeks, Romans, and Indians. A towering figure from this era was Al-Zahrawi, also known as Abul Qasis, who lived in 10th century Spain. He was an incredible surgeon who wrote a 30-volume medical encyclopedia called the Al-Tashrif. The final volume, dedicated entirely to surgery, was the first fully illustrated surgical guide. He invented over 200 surgical instruments, including the first forceps for childbirth, special hooks, and scalpels. He was the first to use catgut for internal stitches, a material that dissolves naturally in the body. His work was so influential that it was translated into Latin and used as the primary surgical textbook in European universities for the next 500 years. The real revolution in surgery, however, had to wait for 3 major breakthroughs. The first was a proper understanding of human anatomy. This came during the Renaissance, thanks to Andreas Vesalius. In the 16th century, he defied tradition and performed his own human dissections. His groundbreaking book, On the Fabric of the Human Body, corrected hundreds of Galen's errors and provided the first accurate, detailed maps of the human body. For the first time, surgeons knew exactly what they were cutting into. The second breakthrough was anesthesia. Imagine having a limb amputated while you were wide awake. For most of human history, that was the reality. Patients were held down, given alcohol, or told to bite on a leather strap. Then, in the 1840s, a dentist named William Morton demonstrated the use of ether as a surgical anesthetic at Massachusetts General Hospital. For the first time, a patient underwent a major operation without feeling any pain. It was a miracle that transformed surgery from a torturous last resort into a viable, humane treatment. The final piece of the puzzle was the germ theory. Even with anesthesia, most surgical patients still died from infections. Surgeons would wear their street clothes, use unwashed instruments, and move from an autopsy to a live patient without even washing their hands. Then came Louis Pasteur, who proved that invisible germs cause disease. Building on this, a British surgeon named Joseph Lister pioneered antiseptic surgery in the 1860s. He started sterilizing his instruments with carbolic acid and using it to clean wounds. The results were astounding. Death rates in his operating room plummeted. His methods were initially mocked, but they eventually became the standard of care, giving birth to the modern, sterile operating room we know today. So, who made the first surgery? It wasn't one person. It was the brave Stone Age healer drilling a hole in a skull. It was the logical Egyptian physician stitching a wound. It was the brilliant Indian surgeon Sushruta rebuilding a face. It was Al-Zahrawi designing tools that would be used for centuries. And it was the modern pioneers like Vesalius, Morton, and Lister who finally conquered anatomy, pain, and infection. Surgery is the result of thousands of years of human curiosity, courage, and a relentless desire to heal. Thanks so much for joining us on this journey through medical history. What topics should we explore next? Let us know in the comments below. And if you enjoyed this video, don't forget to like, subscribe, and hit that notification bell so you never miss an episode of Who Created It and How. See you next time.